My name is Claudia Habel. I'm from the Austrian Public Health Institute, the Gesundheit Österreich. I'm happy to welcome you on our this year's 2020 session in the Gesundheit format. It's a new format. Actually, we would talk now about value-based healthcare, because this was the topic of the session we have developed already for this year Gesundheit before the pandemic all hit us. So we have developed already a nice setup, but soon, as we are the National Public Health Institute and are heavily involved in supporting our Ministry of Health in crisis management, in the beginning we even said, oh, crisis control, this is what we have in mind. But soon we realized that we need to change the topic of this session today and talk about our daily life, which is the dilemma we all as knowledge brokers and advisors are faced with. We could structure these problems, I would say, in 4 areas, for instance, the evidence generation, or know your facts and know your science, the decision-making, the communication, and of course, the ethic questions we are faced. Our session should address all this. Now I'm glad that I may hand over to Josep Figueras, who will be the moderator of today. I think most attendees will know him, I guess, because he's one of the faces of Gesundheit. So, Josep, it's up to you.
Hello. Good morning. My name is Joseph Figueras. I'm the director of the European Observatory on Health Systems and Policies. We are broadcasting from our Gesundheit studio right here in Brussels at the core of Europe. What I would like to do in the next 10 minutes or so is to give you a sense of the protagonists. So Claudia has told us about this dilemma of science to policy and politics. Claudia has told us about what are the pillars of that dilemma, the quality of the data, the ethics involved on that, the quality of the communication and the knowledge brokering. So what I like to do now in the next few minutes, as I said, is introduce you to the protagonists in this dilemma, in this interface, is this very complex interface between science, policy, and politics. As has been said a lot too much these days, COVID is leaving us with a dramatic disaster in our societies in all sorts of ways, and at the same time is leaving us with lots of experience, lots of expertise in many areas, and this is indeed one of these areas in which we are acquiring expertise, which we hope will be able to use in future crises, or if not in the future crisis, in the governance of our health systems. So who are the protagonists? The first one, a seminal protagonist here in the COVID world, in some ways, is the evidence problem. Effectively, we're flying blind. And the seminal work here is not perhaps in the area of COVID, it's a bit older, is this Prussian General Karl von Clausewitz, on a seminal work called On War from 1873. And he's talking about the data and evidence amidst the fog of the war, the fog of the pandemic. So the fog of the war and the pandemic obviously are the metaphor here that we are exploring. So war or COVID pandemic is the realm of uncertainty. 3/4 of the factors on which action in war is based are wrapped in a fog of greater or lesser uncertainty. A sensitive and discriminating judgment is called for a skilled intelligence to send out the truth. So we're going to talk today about this skilled intelligence, about these protagonists that have to have this skilled intelligence, because indeed we are in a war and we're not even sure what the casualties. We don't know how many people are dying. We have all this debate about excess mortality, whether excess mortality is reflecting the mortality from COVID. We have all this debate about the cases. Of course, the cases have to do with the number of tests. So we have a problem of flying blind. We have a problem of numerator and denominator, because we don't even know the population at risk in many instances. So in these protagonists, the first ones to face this problem is the research and the researchers. So we are facing a situation with poor quality, not only of the epidemiology, but on the evidence of the interventions, which is explained by the complexity itself, and is explained as well, needs to be balanced by the speed in which we need to support our policymakers. A question later on will be addressing this particular area. In this slide, which I will not go into any detail, shows some of the uncertainties, some of the debates. Uncertainty certainly in the area of evidence. This is a retraction from the Lancet. Later on, Richard Horton has published an editorial saying that the Lancet is in the process of peer review of their systems, peer reviewing the review process, the peer review process, as it were. Although he argues that a retraction is a good sign, actually, that the system works well. And then there's a range of articles in areas such as the masks and the distance. We're extremely lucky today to have Professor Trish Gringlach, whom I will introduce in a minute, who has done, without exaggerating, the seminal work in many of these areas. And on top of that, she is doing research on the knowledge to evidence, on the translation to practice. So this slide reminds us on the weapons of war, on the interventions we have to fight that war. I don't want to go too far on the metaphor of the word, however. So the next one, so somehow to characterize these researches and that evidence is this slide, which if you put a bit of color, if you make it slightly more modern, would be quite up to date. It's talking about how do you have some prevention rules, like the way you cough, how to wash your hands, how to wear masks, and talks about closing schools, churches, theaters. And this is from 1918, the Spanish flu. Many of you will know why it was called the Spanish flu, which is very relevant to our debate today. It was called the Spanish flu because in the First World War, Spain was the only, one of the few neutral countries, and therefore were releasing all the actual evidence. And it showed that Spain had more cases than those involved in the war that were quite happy, quite keen on not sharing their epidemiological situation. So as we discussed with Trish in several occasions, and we agree, perhaps the precautionary principle would have been a good way to go about on this area, rather than agonizing for all these many months about some of these measures. Maybe we should have started with these measures from day one, wearing a mask and so on. So I started with the protagonists being the researchers and the research, to move to the policymakers. Certainly, for those of you who saw yesterday the debate in American television between the two candidates to become president, will know and understand that very well. Actually, you don't need to see the debate to understand that very well, to understand the complexities of evidence that is so close to policy and to politics. There's a good way to summarize that, which says decision making, which says that policy and politics becomes one in emergencies. So science, policy, and politics becomes all one in crisis. And indeed, the COVID is a crisis. But as we look at the policymakers, we should not be that harsh as we sometimes are, because we need also to understand that when we look at the evidence, we need also to respond to take into account the socioeconomic, political, and cultural realities. Some of the decisions on prevention, on interventions, are very much done not only by the evidence and the epidemiological situation in different countries, but by these socioeconomic, by these political and cultural realities. For instance, you could talk about the Swedish exceptionalism and opinion corridors. That's a very interesting cultural phenomenon and social phenomenon there. The love of the Dutch for the autonomy and liberal values, or the rejection and aversion of the Brits into the nanism. So as we judge, as we talk about these policymakers, our second protagonism today, we need to be aware of these cognitive biases. We need to be aware of these socioeconomic realities. and we need to be aware of the complexities they face by having science, policy, and politics all together at a very fast pace. And to remind you, my motto, our motto of those who are into evidence to practice, that decision making should be based in many instances, ideally, to the evidence, but in practice, it's informed by evidence, because the other values are also very important. And finally, because I'm going over the 10 minutes and Claudia has given me the evil eye already, we have the knowledge brokers. The knowledge brokers, perhaps in this audience today, in the participants today, and in the presenters, are our key constituency today. These knowledge brokers are summarized here by seeing the t-shirts of 3 of these pop stars, you could almost say. I have actually t-shirts from 10 countries already collected with the pop stars that were the communicators, the knowledge brokers in the case of the COVID pandemic. What have we learned very briefly, because our speakers will go in more detail on that? Multidisciplinarity is obviously extremely important. We're missing social scientists in many of these communication exercises. These knowledge brokers are not always have the skills and the training to communicate and do knowledge brokering. Clearly, we learned that transparency and communicating uncertainty is fundamental to create trust, because one core lesson that we learned today, this lack of consistency on the evidence, on the policymakers and the communicators is having a huge impact on low compliance by our population and by our citizens. So extremely important to work on these 3 actors, 3 protagonists. Objectivity and independence from the political process is central, but we'll be addressing in a minute the ethics of that, because we'll see in a minute that these communicators, these knowledge brokers, these scientists sometimes are facing real ethical problems at the time of communicating and providing the evidence, particularly if the policymakers decide not to follow that evidence. Thank you very much for allowing me to do this introduction. I'd like now to quickly introduce, as I said earlier, Professor Trish Grinlach. As I said earlier, Trish has been single-handed having a major impact in the UK on this debate. Earlier on in one of my slides, talking about the ethics also and the differences between groups of scientists, there was an open letter in the BMJ in which Trish is leading a group using science to support policy. I would say the right science, if I may, Trish, and I'm very biased towards you, of course, and another group of scientists as well. In principle, they would say that they are using the evidence as well to argue for herd immunity. But in that case, if you don't look at the ethics and values, you would see that as 2 groups of scientists disagreeing with each other. We need to look more closely at these 2 groups of scientists. But I'm sure probably Trish, in her presentation, will be addressing these kinds of dilemmas she's been facing as she communicates evidence and as she has impact on policy making in the UK. Trish, the floor is yours.
Yeah, thanks very much, Joseph. So I was asked to speak about how to give serious advice when evidence is scarce or contested. And I'm just waiting for the little arrow to move my slide on, which I can't see. There it is, found it. Okay, so I thought I would talk a little bit about long COVID. I've just had an email from a guy I don't know. He just wrote to me and said, I read your article on long COVID, and these are my symptoms. A great long list of random, almost random symptoms. And then he says, well, I tested negative for COVID and my wife's tested negative, and yet our lives are turned upside down by this terrible thing, which has made us depressed and tired and all the rest of it. And what are you going to do about it? Well, please help. So before I answer his email, let me distinguish 2 different kinds of science. On the left, we have the study I'm sure you're all aware of dexamethasone for severely ill patients with COVID-19. In that situation, randomized controlled trials were straightforward. They quickly produced definitive evidence, and everyone was very pleased that science delivered the goods in a timely way and saved lives very quickly. With long COVID, we can argue about what it's defined as, but the patients say long COVID is COVID. It hasn't got better when you expect it to. Its etiology is contested. The diagnosis is contested. The care pathway is contested. Who's looking after these people? The treatment is contested. Now, let's go back to dexamethasone and our lovely randomized controlled trial. It fits very nicely in the paradigm of evidence-based medicine. You probably all know the PICO acronym, Population Intervention Comparator outcome. Here's the drug compared with placebo. And you've probably seen something like this triangle, the hierarchy of evidence with systematic reviews of randomized controlled trials at the top. And then down through the colors of the rainbow, down to the bottom level of case-based reasoning or expert opinion. This is a very, very powerful visual metaphor. And the implication is that we need to prioritize randomized controlled trials over actually the reasoning and deliberation and reflection and discussion that might make us conceptualize problems and interpret them in rich and productive ways. Now let's go back to long COVID. How do we diagnose it? Do we need a positive test? What if the patient, like the man who emailed me this morning, tested negative? What if they were never tested? Are we going to take the official definition currently being used in the UK? You can only have long COVID if you were in hospital. Are we going to say, oh no, it's only in people with signs of end organ damage? But what about people like this gentleman who emailed me who just feels terrible and he can't see any future? He has nobody he can talk to at the moment. His GP says this problem doesn't exist. Are we going to allow people to be diagnosed with long COVID if they just have fatigue? Or do we have to say, no, you've got to have breathlessness, or maybe you can have anything, just blue toes will do. So these arguments are going round and round. I should say I've just agreed to be on a national guideline committee about long COVID, and we were discussing all this yesterday. But look about the different ways that we can frame the treatment of long COVID. We could use a biomedical paradigm, as in the dexamethasone trial. It's really what we're doing is searching for drugs to treat an underlying damage to the blood vessels, an inflammatory condition. You've heard all these very scientific, very biomedical arguments. But we could say, no, this is about rehabilitation. It's about rehabilitating the patient back into society, back into their normal activities. We're going to be talking about self-pacing, about cognitive support. Or we could, as GPs, and this is my personal preferred paradigm, we could sit long COVID as part of relationship-based care. The doctor or other clinician is a witness to the patient's suffering, and our job is actually to avoid over-referral, over-investigation, over-medicalization. Almost everybody's going to get better. Let's just let the disease run its course. But then we could be more radical. We could use a critical race theory paradigm. We could say people with long COVID and COVID more generally are victims of structural racism, issues around stigma, discrimination, poverty, social exclusion, citizenship rights are highly relevant in COVID. So you can see the different treatment paradigms, management paradigms need to be discussed and deliberated. It's not obvious that we are sitting in paradigm number one, which is where we very comfortably sat in the dexamethasone trial. Now, I'm going to spend a bit of time on this slide because we wrote an article for the British Medical Journal around managing uncertainty in COVID-19. As Josip has already said, pandemics are complex systems. Uncertainty and paradox are inherent. We will never get rid of uncertainty and paradox. And if we resolve today's uncertainties, we will create more uncertainties. So how do we deal with that? Well, one of the things about complex systems is let's have some simple rules. And those simple rules can inform one's approach to managing the complexity. We don't resolve it, we manage it. So the first is that data are always going to be flawed or incomplete. We need to be honest and transparent about this and not pretend that there is more certainty than there actually is. For some questions, we're never going to get certainty. So we need to make a judgment. And yes, it was talking about the question of face masks and whether we should introduce them before evidence is definitive. We really do have to make a judgment as to whether it is ethically right to wait for definitive evidence or act on the evidence we have using the precautionary principle. Third simple rule, we need to make sense of complex situations by acknowledging that they're complex, by admitting that we don't really understand them, by surfacing and exploring paradoxes, and by reflecting collectively. And it's that discussion and deliberation around our areas of ignorance, around the paradoxes that we can't resolve, that actually sometimes helps us make progress. The fourth simple rule is that different people and different stakeholder groups interpret data differently. They interpret evidence differently. Now, that may not be a bad thing. We may not need to achieve absolute consensus on every aspect of this pandemic. Perhaps deliberation among stakeholders could generate multifaceted solutions. I view the problem in this way, you view the problem differently, but perhaps we can bring in a solution that speaks to both of our versions of the truth. And finally, and something I want to take forward in the next slide, pragmatic interventions carefully observed and compared in real-world settings can generate very useful data, which can complement the findings of controlled trials and other forms of evidence. Suck it and see, we say in the UK sometimes. Now, this is a slightly complex diagram, and so I'm going to talk you through it. If you just look at the top row, first of all, this is your standard evidence-based medicine approach, which was done, for example, in the dexamethasone trial. We develop an intervention. In that case, it was a drug, but it may be a public health intervention, a behavioral intervention. We do a pilot study. Once we've refined the approach, we do a randomized trial, and then perhaps someone else does them and we get a meta-analysis. And at that point, when the meta-analysis has produced the definitive result, we take policy action. Now, in the pandemic, that may not always be the most appropriate approach. We may want to have a more pragmatic approach, which is illustrated in the bottom row of this diagram. We developed some policy based on our knowledge of what's going on at the time. It's imperfect knowledge. It's a pragmatic policy. It's not going to be exactly right. And so what we do is we evaluate that policy as we implement it, quickly, using the best data we can get hold of and feeding that back into adjusting the policy as we go along, the real world evaluation. Now, you can see that in the middle of the diagram, I've got things that connect the top and the bottom, because what we might start with is observational evidence. And actually what we had back in March was what was going on in China, what was going on in Hong Kong. That's all we had. And I was emailing my Chinese colleagues, actually, and they were sending their observational evidence as to what was happening. And of course, that can inform both the interventions, but also this direct policy action. Let's quickly do this. But the other thing that's quite interesting about this diagram is that we can feed back into specific targeted randomized controlled trials, even when we are taking pragmatic policy action. So what I like about this diagram, and it's adapted from a lovely paper by David Ogilvy and colleagues, it's not my diagram. What I like about it is it's not saying the pragmatic response needs to replace the randomized controlled trial. It's saying sometimes we have to take this pragmatic response, but that the evidence and the emerging findings from that pragmatic approach can inform more targeted randomized trials of particular interventions. I've written about this. I've written about post-acute COVID, if anyone's interested, in the British Medical Journal. But actually, perhaps more relevant is I've written about whether COVID-19 could be evidence-based medicine's nemesis. In other words, are we coming to a time when evidence-based medicine simply doesn't address philosophically and practically the challenges that we need to face? It falls short because of that triangle with the RCT at the top. It's too methodologically rigid. It doesn't leave enough space for debate and deliberation and pragmatic solutions. So thank you for your attention. I look forward to responding to your questions later.
Thank you very much. Thank you very much, Trish. That's been impeccable, as always. Let me ask you just a short question, and then we'll bring you back later on. I am very pleased myself that you mentioned that the triangle of evidence-based medicine is not that applicable, and the COVID has shown that to us. We've been arguing that for quite some time, those of us who've been doing research on the actual organizational and health system interventions. But let me ask you a very short question and we move ahead. I had read about them. I love your explanation and your presentation on your rules of managing uncertainty for those who are producing the evidence and advising policymakers. However, would you, can I challenge you, Trish, to now develop the rules for managing political uncertainty at these moments? Because in these rules, you have not yet included, and you will do that in the next generation, the issues of trading values, the issues in which there is some evidence as to, for instance, now about the value, about the economy, about the impact of the lockdowns, for instance, on the economy, the impact of lockdowns on the health status, the values, indeed, of our elderly population. We've seen in some countries that were quite prepared to actually let them, that population, to suffer in nursing homes to achieve herd immunity by the younger. Those are real value trade-offs. Those are real issues that our policymakers are facing. Would you care to shortly comment on that?
Yeah, absolutely. And I totally agree. The relationship between science and politics is something I didn't talk about a lot on this, partly because that wasn't my brief. But yes, Martin McKee, as you know, has done some, recently published a paper. I'll find it and I'll put it in the chat, about the different political systems and how those political systems have been differently interpreting the science and differently valuing the science. And I will put that in, but I also want to draw people's attention to an article actually in this morning's Times, in the London Times, by Graham Medley, who's one of the modelers from Imperial College. So he's a scientist. And the article is called "Scientists Shouldn't Have the Final Word on COVID-19 Plans." So what he's saying is, I'm a very clever professor. I do this very clever modeling. But actually, some of the questions, for example, about lockdown, about segmentation, should we lock away all the vulnerable people so they don't get in our way, so the rest of us can live a free and libertarian life? Those are not questions of science. Those are questions of how should we run a society. They're questions of political philosophy. And he is arguing, as I have argued, for a greater place for public and political deliberation. And I think, one of my big concerns about what's going on in the UK is that public debate seems to have stopped, as if scientific experts have got the answers. And of course, we can provide information to inform the debates, but those debates are not themselves questions of science. And as Immanuel Kant said, can I just bring my philosophy in? There's three types of questions in the world. There's what can I know is one type of question. The second type of question is what should I do? And the third type of question is what dare I hope? And we cannot reduce any of those questions to any one of the other questions. Sorry, I went on too long, but there we go.
That's absolutely perfect. That gives me a great bridge now to the next block of the session. And by listening to you, Trish, which indeed we did not ask you to talk about the politics, but about the science, helps me very much to introduce now the rest of the panelists.
Joseph, there were questions to Trish also in the chat. Can we take this one question still? Is this
absolutely,
possible?
Absolutely. Go ahead, please, Claudia.
Okay, so somebody says, Trish, could you say more about the interesting coalition that has grown up around the argument that we should not act on face coverings, restrictions, etc., until we have definitive random controlled trial evidence?
Yeah, I mean, that's actually where I started. And I thought I wouldn't talk about face coverings because it's so emotive. So that's why I talked about long COVID instead. But we could have used that as an example. What we have here is people who are tied into a particular paradigm and they have misunderstood, actually, I think, the place of the randomized controlled trial. Particularly, there's a trial ongoing at the moment. I think it's finished, but it hasn't been published yet, called the Denmark trial, where they have actually randomized 6,000 members of the public in Denmark to either wearing a face covering or not. The problem is that what they're doing is measuring whether that individual then develops COVID. That's not what face coverings are for. They're for source control. That my mask stops you getting COVID and yours stops me. So they've designed the trials wrong. But because they are so hooked into that method, they still want to continue doing a randomized trial, even if that randomized trial is asking the wrong question and using the wrong outcome measure. So they've got the science a bit screwed. But why is there an alignment? And this is what the questioner was asking. Why is there alignment between those kinds of scientists and some political lobbying groups? And the answer is that those kind of scientists, maybe not particularly political themselves, but their findings feed the agenda of the lobbyists, who then shower accolades and praise onto those scientists. And yes, we have a very, very troubling alliance of a particular set of groups. Now, I think we need to push back on that and question it. But at the moment, there isn't the space in the public sphere, certainly in the UK, for doing that. I mean, as you know, if you read my stuff, I've been trying, but it's not easy. It's not easy.
Indeed. And I would argue, Trish, that those scientists also, if you look at their cognitive values and biases, in some instances, they have strong values underlining the science they present. So it's not only those groups hook into that science, but the scientists themselves have their own. And I would argue that's what happened at the moment with the debate. You have Trish leading a group in contrast with the second group of scientists around the lockdowns. But as I say, and great Claudia that you interrupted me, the whole point in this session today is I will bring questions from the floor, from the online audience throughout this session. The way we're going to go about now is as follows. We'll have 4 short lightning interventions, and then we'll move to a series of votes in which the online audience will vote. And then based on those results, we'll be debating the kinds of issues that Trish has already put on the table very effectively. As I said earlier, let me now introduce the rest of our protagonists, which, like Trish, they're not really stereotypes, the opposite. Trish understands very well the complexities of policy making. She understands very well the knowledge brokering. So she's not just a pure scientist, but she understands the other dimensions. And so are the remaining of our panelists that I'll be introducing one by one before they do their presentation. Therefore, let me first introduce Christopher Fern. He likes to be called Chris, he says. Only his mother calls him Christopher. I just learned that from him. Deputy Prime Minister of Malta. I have lots of wonderful things to say, all of them wonderful about Chris. Chris, someone who's Deputy Prime Minister now, he's been Minister of Health, is someone, again, not a typical politician, is someone that, don't want to be nasty with politicians, by the way, but is someone with a huge understanding of the research, of the evidence, of the knowledge brokering. So we have an ideal first lightning talk today. Please, the floor is yours.
Thank you, Josep. I take it that saying I'm not a typical politician is a compliment rather than...
I meant it as a compliment, that's right.
Thank you very much. Okay, so as you say, in this relationship between scientific advisors and policymakers, I am more of an advisee rather than an advisor, in that as Deputy Prime Minister, as Health Minister, I depend a lot on the evidence that my advisors, that my scientific technicians give me to make decisions. But I am also an advisor to my colleagues in cabinet, to the media, to the social media today, because we are a Facebook generation today, and eventually to the patients that suffer or benefit from my decisions. And it has to be said that, especially in something as widespread as COVID, colleagues in cabinet have different agendas. So the health minister obviously has the public health agenda, but then the economy minister will have an agenda that makes sure that the economy isn't suffering, the transport ministry likewise, the tourism ministry likewise, the education ministry. So there are different agendas, and these all need to be addressed. And politicians are fickle people. They want, and I think there was this point already, they want advice or they want evidence which fits in with their narrative. And sometimes it's rather not the narrative or the decisions are based on the evidence, but the politicians sometimes try to find the evidence that goes with their narrative and with what they would want to decide. So there will be unwelcome truths, but there will also be unavailable, what would otherwise be welcome truths. In other words, advisors need to make sure that they are giving the advice which is based on the truth and on facts, because there will be a lot of pressure, and it's, especially in smaller communities, favors will be carried by those who give the advice that is pleasant on the ear. So my advice to advisors is stick to your facts, stick to what you know, but also don't be afraid to say what you don't know. And also, ideally, as Josep keeps saying, all the decisions are evidence-based. But in situations like COVID, where things happen very fast, and I say we are a Facebook generation, so decisions have to be not only taken, but they need to be defended within hours rather than days, weeks, or months. So normally you would only give advice on what you know and what you are sure of, and not on something that you aren't. But in something as fast and as new as COVID, then my advice would be, fine, say what you know, but also say what degree of certainty you know it. So, and make sure that you can differentiate yourself, and that the people taking your advice can differentiate from you, whether what you are saying is evidence, is hard fact, or whether it is judgment or opinion. Because you're allowed to have judgment, if you're an expert, you're allowed to give your expert opinion, but you have to make it quite clear where the facts start, what degree of certainty there is associated with the facts that you are giving, and where it is a question of judgment and of opinion. At the end of the day, the most important thing that science has is trust. People trust it. Once that trust is lost, and that trust can be lost if you give advice which is deemed retrospectively to have not been correct, it is very difficult to get it back. And once the trust is lost, then the kudos is lost with it.
If I understand that well, you finish just on time. This is incredible. You made it pile, as the French say. Thank you. I wish there are many, many knowledge brokers listening today, Chris, because you gave us the perfect rules. I was asking earlier, and Tricia started thrashing out for those knowledge brokers to work with policymakers. It is indeed truth. All what you said is truth, of course, Chris, that we knowledge brokers, if we want to sell our evidence, we need to look for those policymakers that already agree with our evidence, that they want to implement our evidence. There where we have real success in knowledge brokering. But the problem, Chris, the question to you is, you say, don't be afraid to say what you don't know. Isn't that a risk to lose your job to do that? Many policymakers, not you, and I respect politicians, by the way, very much. Do not take me wrong. I just think it's ideal to have a policymaker like you, a politician that has such a nuanced understanding of the evidence. But in many instances, they will lose their job, wouldn't they, Chris?
Yeah, they will lose their job if retrospectively they are deemed to have given the wrong advice. And we're seeing this. I mean, it's unfair because when it's a situation that is so new and so vast, people expect you to give advice, and they put pressure on you to give advice. Because as a politician and as a decision maker, my job is easy when I have evidence, when I can say I've been told that this is what I need to do, and I do it. When there isn't evidence, then I have to make a judgment, and I have to carry the weight of that judgment. So for me, it's much easier if my advisors give me advice. And then if that advice is wrong, then I sack them. So that's how politics works. So for advisors, they have to be, if you want to keep your job, give the right advice. And if you don't have that advice, just say you don't have it. Or you're allowed to give your opinion if you're asked for it, but you have to say this is an opinion and it's not a fact.
Thank you. Let's move now to Camilla Stoltenberg, the director of the Norwegian Public Health Institute. Camilla, if you want to start exactly to unmuting yourself, you are one of those advisors, and I'm so pleased that you have the time as well today to join us. I have my biases with all of you today, as you can see. They're not biases, they're truth evidence-based. The way that your institute, the culture of evidence in Norway. Every time I'm there, I'm so impressed. If I ever say something positive about the Norwegian health system, the politicians and policymakers themselves say, no, you are wrong. We have to be better. The evidence is biased. This self-criticism, this transparency, this debate, I fall in love with. So, Camilla, your topic is when evidence is limited, trust is everything, which tallies beautifully with what's been said so far by someone who's exactly there between the evidence, generating the evidence, and working with the policymakers. Camilla, your 4 minutes of glory. Thank you.
So good morning to all of you from Oslo, and thank you for this opportunity to talk about something very important and close to my heart. So when a new infectious disease occurs and spreads, we know far too little about the microbe and the epidemiology, and even less about which preventive measures that will be most effective and which treatment is best. In this situation, we must give our first advice based on the next best thing, such as knowledge of similar microbes. So for AIDS, for instance, in the 1980s, we based our initial advice on the knowledge about hepatitis B. And for COVID-19, we initially had to refer to SARS. So we need scientific knowledge. We must review and summarize existing scientific knowledge, and we must perform our own research and analysis. We must do it quickly with high quality and by sharing of everything from ideas, data to technologies and results, failures as well as successes. Since January 2020, the world has developed knowledge about COVID-19 at a speed and scale we've hardly seen before. but it takes time to develop sound scientific knowledge. And for those measures that most of us are most concerned with at the moment, that are not about drugs or vaccines, there is very little knowledge, even of the pragmatic kind. And the quality of many studies may be poor or yield divergent results, which is exactly what we found when we reviewed the scientific knowledge about face masks in use in society and the effect of this infection control measure. There is disagreement about most of the basic infection control measures in the COVID-19 pandemic. And although it hasn't been that visible in many countries so far, I'm sure it will be soon. And the use of face masks in society has created discussions not only in Norway, but in many countries already. It is an example of an infection control measure where we are expected to provide clear advice, but where evidence is limited. So how can we give professional advice? We can use an evidence to decision framework to review the knowledge and prepare a recommendation, and we can show how we have assessed different documentation. This framework considers other important factors, such as the documentation of the disadvantages, the balancing of advantages and disadvantages, equity, acceptability, and feasibility. And when communicating advice and recommendations, we must be open and transparent about the strengths and weaknesses of the scientific evidence in order to build trust and support for advice from public health authorities and government in general, and for the specific measures. In dealing with COVID-19, many countries have adopted the most intrusive societal measures in peacetime. Transparency about the scientific evidence and its weaknesses for drastic political choices is a prerequisite for the trust on which crisis management depends. Precisely in crisis, where decisions must be made quickly, despite uncertainty, openness about scientific knowledge and knowledge gaps is crucial. Openness that creates more trust than insecurity, more understanding than confusion, more democracy than polarization and conflict. And I'm deeply concerned about what is happening in several places in the world during the pandemic. Public professional bodies, which have previously been the main sources for independent analysis and knowledge-based advice, are deprived of their professional independence, instructed on what to do and communicate, and politically overruled. We should aim to increase openness along the way, not for the sake of openness itself, but for the sharing of power and knowledge to challenge ideas, accelerate development, and increase the legitimacy and quality of knowledge, processes, and decisions. Thank you.
Brilliant. Thank you very much, Camilla. Clearly a theme of openness and trust is coming out from each one of you today. Camilla, the Norwegians, you done particularly well with the numbers, better than your neighbors. Is it really all about trust, or is it simply because you in Scandinavia just behave? You know, you just do well. You just, if the people are given recommendations to wear masks, have social distance, even if not imposed, regulated, or sanctioned like we do in some of the countries in the south, just people behave like the Swedes, your neighbors, have been arguing. Is that so?
Well, I think trust is incredibly important, but also I think we may have been lucky. I mean, the way the COVID-19 or the SARS-CoV-2 virus entered Norway might have been a lucky one. It was at an early stage of the epidemic that the government decided to implement drastic measures, and was relatively soon thereafter that they were slightly and slowly and in a very controlled way lifted to some extent. So we also had a lot of open debate, even in that phase, but it was not very conflicted. So I think trust is incredibly important, regardless of how it goes, actually.
Excellent. Thank you very much. You see what I told you earlier? Rather than taking the opportunity to say how good we did in Norway, she said, well, Camilla says we've been a bit lucky. That's exactly the openness and trust we're talking about today. I like now to introduce Rafael Bengoa, who wants to start unmuting already. I'm very, very pleased to have Rafael today here, now Director of SI Health. Rafael, I'll ask you to be a policymaker today. I'll ask you to be the former Minister of Health of the Basque Country, as you were, but you are here, as the other colleagues, everything. You've been Director of the Chronic Diseases, NCDs in Geneva, in headquarters in WHO. You've been involved in various areas of research. And as I said, you've been Minister of Health. And now we work together, Rafael, in this new Monti Commission looking at the future of health systems, in which you, Martin McKee, alias Mosialos, are the three only commissioners that are actually researchers as well as policymakers. Martin is not. And the rest are all former politicians, actually, high-level politicians. And a lot in that Monti Commission applies to the debate today, Rafael. I have the pleasure to be running the scientific board for the Monti Commission. Rafael, I'm very interested to hear about your title as well, The Dangers of Groupthink in a Pandemic. 4 minutes for you.
Okay, thank you very much. It's nice to see you again, Josep, and thank you, Claudia and company, for inviting us. I think Spain is in as you know, in a very particular and very tense situation now. In parts of Spain, the link between science and politics worked well. And interestingly, in those parts of Spain, the virus is much more under control than where politics took over science. So Spain is a sort of a natural experiment in that sense. So the things you're hearing about Spain are not uniform for all Spain. They're basically around Madrid and other parts, but getting very messy. So in relation to your question, I mean, I think some of us have been trying to advise more through media and through pressure via the Lancet, where we've asked for an evaluation of what happened in the first wave. And that's being discussed today by government to decide whether they launch an external evaluation, which is not part at all of the Spanish culture. They don't like that type of external evaluation. That takes me to your question, Josep, which is basically everything in Spain has been controlled from within each of the different political groups, wherever they are in the country. And basically, everybody was over-optimistic after lockdown and opened up a bit, obviously too much in some parts without really being ready. Now, but what it was behind that unreadiness, or what was really behind that, is a lot of the groupthink thinking. I think most of the political parties have tried to run this as an official line of thought with the typical insularity of political thought in my country. Now that has brought much more politicization than necessary into the system, because in some parts science was just shut out. It was just run from within some of the people within the administration, but basically a whole bunch of people that could have added a much more, let's say, stronger scientific outlook, even with its weaknesses, as we've discussed this morning. I think that insularity has created a big problem, and we're paying a price. And it has reached the biggest level today, and since yesterday, because the national level yesterday had basically had to take over and say, in some parts, concretely Madrid region, forcing the regions to lock down according to certain indicators. Now, we shouldn't have had to do that in a country that in everything else in a decentralized way was working well. But in this way, I think that insularity, that groupthink inside political parties has brought us to a very negative situation. So I think just to finish off, I think what we're trying to do from outside, advising different governments in Spain, is to learn from independent evaluations, not looking for blame, etc. And we've tried to use international journals like The Lancet, and that has worked, I think, well. It has influenced the thinking, and that is being decided actually today. But I think in general, the doubts that have been created by science at certain moments, including WHO during the pandemic, have weakened science and has established a frame of mind in some politicians where they say, look, I think I know better than them. And that has created the types of issues that I just discussed. Thank you.
Perfect. And these types of issues, Rafael, as we agree in many occasions, have led to very, very low levels of compliance among the population, and therefore the failure of many of these interventions to take root and to have an impact. Rafael, in the observatory, we were doing some study about the decision making on COVID on federal countries. And yesterday, actually, several ex-ministers in Madrid, I was talking to them about governance in federal countries. Rafael, I think this crisis is helping us as well to understand the difference in which the South and the North, and I don't want to fall in the stereotype because you said it very nicely, Spain is a natural experiment with regions working very differently. But in general, the way that the Nordics, being highly federal devolved countries, the way they behave during the COVID have been much more aligned between the different counties, the different municipalities in these countries than we did in the South. Although Italy has quite paid a lot of attention to Rome at the difference of Spain and Madrid. Could we care to elaborate a bit more about that, having as well been former Minister of Health of a region which is particularly devolved, if I may say so, the Basque Country?
Yeah, well, I mean, I don't think there's so much as a north-south issue than a trust issue, as we were discussing before. Yes. In the following sense, I think people in Spain have seen and lived now 5 or 6 months of political disunion and political argumentation in an explicit and via media. Have seen that the political groups do not meet to take decisions together, whether it's federal and regional together or at the national level, 3 different political groups. So when the population sees that disagreement, plus they start feeling that the science is a bit whiffy-waffy in relation to masks and whatever, well, you know, the people then take personal decisions. And so I think that's also in the north, it's in the middle of Europe and in the south. I think it's everywhere. And
we've seen that in the UK as well, yeah.
Yeah, well, what do you see in many countries is you see that political union, and also that is in all history books from the flu epidemic in 1918 was where they got their act together as politicians. St. Louis, concretely, did much better than Philadelphia and Pittsburgh, where all the politics broke down. Now that is really interesting, but we just don't learn. And the politicians in Spain are just creating an extremely difficult situation and actually almost creating this week a situation for a 3rd wave. So if we control the 2nd wave, hopefully, we're still going to have a lot of virus around for the 3rd wave if the behavior is the same. So that's what
Impeccable, Rafael. That's extremely useful. Now, last but not least, by any stretch of the imagination, I have a great pleasure to bring in on board Herwig Ostermann, who's the director of the Austrian Public Health Institute that is bringing us today together here. I have a great admiration for you, Herwig, apart from being good friends, because you're a professor, you come from academia, you are leading a knowledge broker and a major research institute, and you are in the hot seat advising the Ministry of Health, advising them and helping them to make the decisions. So it's ideal, Herbie, to have you here and taking the topic of experts' advice addressing the COVID pandemic challenges, and particularly, Herbie, outlook, where we move going with that. The floor is yours.
Well, thank you very much, Joseph, also for this introduction. Usually when we meet in this kind of venues, we would all first present ourselves and claiming our initial expertise. And I have to admit I'm an economist by training, but nowadays I rather focus upon the fact being a public health professional. And what I observe, at least for the Austrian case, is that even people that have their doctoral degree in medicine, they also say I have a master's degree in public health. I will come to that later on, because I think we observe somehow the need for more public health and also more public health expertise. As you mentioned, I'm so to say a formal advisor. I'm a member of the advisory board to the Austrian Minister of Health, but also a member of the COVID advisory board in northern Italy, in the Alto Adige region. And since August this year, I'm also a member of the so-called Corona Commission in Austria, which is a commission constituting of experts as well as representatives of the government, which is intended to assess the risk of the various regions in Austria. And I would like to share with you, so to say, three observations. The first two are somehow observed paradigm shifts, and the third is then rather a call for action. What we observed, at least in this early phase of expert panels in Austria, that actually the issues we tackled there somehow changed their focus. In the first naive phase, so to say, of the pandemic, we asked very much physicians, specialists in virology, for instance, academia, scientists, and everybody was interested in the question how the virus would evolve, how to treat the virus properly, when there will be an immunization available. And at least starting with April, we rather changed our questions to a more public health focus. And the thing also had some impact on the constitution of the advisory panels. At least for the Austrian case, more and more public health experts were brought into the advisory panels, and we now have this kind of two worlds between the medical specialists on the one hand and the public health specialists or professionals on the other. And the question we then addressed were how many people should be allowed in family gatherings, and whether we should make a distinction between, for instance, funerals and wedding parties. So the whole issue got a public health aspect. And also this aspect got broader and broader, and we now, as Trish put out, address or we now arrive at questions addressing our initial civil freedoms. For instance, the question whether somebody with an immunization status should have other rights than somebody that has not, which is an issue that will come up when we have the immunization. What we observed in line with this paradigm shift from medical specialty to public health basically was a second paradigm shift that actually changed from a mere academia more to societal responsibility, in a way that also these experts in the advisory committees became more and more known to the public, and this was also linked to public responsibility. For some of the primary or merely focused academics, actually this involved difficulties, because for the first time they changed their role from this mere world-describing philosophers into a part of a political system, at least in its broadest sense. And this brings me then to my third point, and this might be some kind of outlook. What I think we definitely have to address the question whether political advisory or expert opinion is a discipline in itself, and whether we should not focus more upon various schools of public health on this issue, maybe also come up with some course. In fact, it's an art, just like facilitating an online session, actually giving good political advice is somehow an art and a discipline, and I think Gastein is a good place to discuss this issue. Thank you.
Thank you, Hervik. And I think your institution and you yourselves in various sessions, not only in Gesundheit and elsewhere, you've been very much pushing this area of the science and art of knowledge brokering and policy advice. And by the boss of the institute, yourself, you are a good example of that. I love the 3 stages: medical science, public health, and civil society, freedoms, rights, almost the philosophy as you said, Trish said. Hervik, it surprises me that your skills as an economist are not very valuable right now. I mean, I think they're the most valuable at the moment, together with the values, because we really are in this conundrum of the lockdowns and some of the limitations that we are facing are hurting the economy. And they are, of course, having a negative impact on health status, which at the same time will have a negative impact on the economy. Are you not been asked by those assessments and evaluations of the economic impact, Hervik?
Not really, and I think actually that this is a good thing. I mean, there are specialists for economic forecasting and so on, and what I feel to some extent is actually that our ministries of health and maybe also the national public health institutes and also the public health research community is a bit stressed by the fact that for once now the ministries of health or the health system is responsible for anything. For instance, when you take the Austrian pandemic regulation currently, actually it mandates the Minister of Health to devise regulations not only on the health system, but on public transport, on schooling and so on. And honestly, or frankly speaking, we have never been confronted with these issues before. I found myself once discussing the issues on how should we arrange cable car transports to the mountains when the skiers come. I'm not a professional in public transport.
Well, but Hervik, we shouldn't complain because finally it's health in all policies.
Yes, it is. I mean, that's the weird thing. Actually, now we see what health in all policies actually implies.
We may change our mind, you know. Thank you. You've been brilliant as always. Claudia, now we go back to you. We move slightly behind, but I think it's been really a great debate so far. I'm a bit biased, of course.
Yeah.
To the third block of this, where we get the online views, questions, and voting, and our participants in the panel will have to disclose their vote as we ask them questions. So, Claudia, back to you now.
Thank you. Yeah, we will have now the first question, but in parallel, we can also take a question from the audience. So first is, please vote. What do you believe is more important for policy advice by experts during a global health crisis? Should it be quick information, but perhaps not fully evidence-based? Or do decision makers need to wait for the evidence, so it's fully evidence-based information at a later stage? This reflects one of the questions we have, if we can really act without randomized clinical trials. So please submit. And also a question we could have in the meantime is, if the panel was, I think, referring also to Hervik, saying, so do we need independent advisor groups EU-wide, like an ombudsman institution? It's ombudsmans, I think, or the SAGEs like you have in the UK. Can they really truly be independent? This is something we also have to consider here. So are the votes coming in? Yes, I'll show you the results we have already. So 86% are for answer A, so better to have quick information and not fully evidence-based. So majority is clearly for number A.
Quick information and not fully evidence-based.
Right.
That's terribly interesting. So we are all pragmatic. We got the message, colleagues. They got your message, colleagues. Who wants to comment on that one? I think I'm going to ask here let's ask the politicians, what I call politicians today. Chris, you'll have the opportunity. I guess I know what you voted on this one. What did you vote, Chris, on this one?
I voted with the majority, of course.
Of course. That's why you are Deputy Prime Minister. I wonder if the majority had said the opposite, whether you would have voted with the majority as well.
I might not have said that I voted. But of course, yes, I agree. This is not, say, a normal situation. So in a normal situation, then you'd go for fully evidence-based. But in a fast situation, you need to take decisions fast because they will make a difference to people's lives. literally to people's lives in this case. And it's better to make a decision with some information than to make a decision with no information. But there are two caveats to that. One, you need to know that the information that you are getting, its reliability. So its degree of reliability. So as I say, it might just be a pure opinion, or it might be a solid fact, or anywhere in between. And you need to know that, because that is one of the factors that you need to factor in when you're making the ultimate decision. And secondly, you need to explain this to the public, because if in 2 weeks' time or if in 1 month's time the evidence changes, then you need to change as well. And unless you've explained beforehand that you're going to change, you will find it very difficult to do that, or you might not do that at all, to the detriment of the patients. So yes, I agree, better some advice or some evidence than no evidence, but you have to know what it is, and you have to explain that it might change.
But our academics today hate tremendously they say the jury is out. The jury is out. They don't want to communicate uncertain answers. And they argue all the time, Chris, that politicians are not good at dealing with uncertainty. Any of you care to comment on what? Camilla, please.
Well, I would go for the majority response regardless of the situation, because I don't think there is any other choice. And I also think that our advice should always come with advice on how to get better evidence and how to do the science. So particularly where it's obvious that it could have been done much better in a fairly sort of easily accessible way, then we should come with that science advice in addition to the advice on what actually to do in the current situation. And we should never de-link those two. So we shouldn't accept that there is so little evidence, but we should always give advice even if there isn't.
Thank you. Very quickly, Trish, because I want to push us on. Claudia's looking at me saying we need to move on. Trish.
Yeah, quickly, I agree with Camilla. Look, I think we have to avoid creating dualisms, because in a complex system, we don't have dualisms, either this or this. We have a duality. And a duality is how the poles of this dualism actually are linked. So for this, let's stop talking about should we do things fast or should we wait for best evidence? We've got to do both. We've got to integrate that conceptually and say we need to do something fast, but in addition, we need to work towards the best evidence we can get. And how can we do those two things together in a way that they inform each other?
Perfect, thank you. Claudia.
Yeah, there's a question also which fitting in here. Somebody thinks that politicians act more based on the decisions they will have for future elections than what's best of the population, so that evidence is really of no interest to the policymakers. But is this really true, Chris?
No, I'm just putting on my mic. No, yeah. It's not, because at the end of the day, people will not only judge you by what you decide, but by what the outcomes of your decisions are. So if the outcomes of your decisions are terrible, then that will make you extremely unpopular. If the outcomes of your decisions are beneficial, then that's good. So even if it's just from the sole aspect of interest, vote interests, or popularity interests, then it's still in your interest as a politician to do the right thing always.
Yeah,
yes, because
Sorry.
No, just to say briefly, linking it with the paper from Martin McKee that Trish shared about populism. The beauty of the virus is that doesn't pay any attention on populism. And we saw that populist countries that tried, or politicians that tried very, very hard to steer, to manipulate, then the virus tells them right. Sorry, Claudia, back to you.
Yeah, well, it was a question also perhaps to Camilla, because some delegates ask if it's a shame for the governments and for experts to say if they gave wrong advice, or that there is some uncertainty, and is it hard for someone then to change their minds and say officially, okay, we were wrong in March, we changed our opinions, and then we go this way now? So this could be a question for Camilla or Trish, because, yeah.
Well,
Camilla, perhaps.
yeah,
Hey,
it
Camilla.
definitely is a shame under many circumstances. So I think one of the things that we should take on responsibility for is to say that one has to prepare for being able to change your mind. You have to prepare yourself and the population for that as a politician and as a scientist.
I think we need to push us on, Claudia, because we
Yes,
have
for the
other
next
questions.
question. Yes.
Let me highlight though that and Rafa, I don't see you on the screen. I'm sure you're there, but my screen only allows for 6 pictures.
It could
so you
be
please
he's
do
lost, I
shout,
think.
shout if you're there, and we're not asking your questions. You just shout, and we'll hear you. Claudia, back to you.
Sorry. I think we lost Rafa for the moment, but Herwig wants to say something.
No, I'm fine. Let's go
Okay,
to the
because
next
you mute.
question.
Okay,
Yeah, I'm
you
fine.
unmuted yourself. Okay, I think we should go to the next poll then, Josip, if you allow, because otherwise, I
Please.
looked at the time now, it's only 12 minutes. Decision makers, should they disclose everything that is known about the pandemic to the public? What do you think, dear delegates? Yes or no? Should they really disclose everything? Or could be the reasons why they don't do it? I think this would be a perfect question for Rafa, you're right. Because everybody who says now of you yes must give an example, I think, what you hide from the public. Yeah?
So if Rafa is not on board, we'll ask Chris again. Sorry, Chris, we'll ask you what you vote there. You have to tell us what you vote. And we're watching you. And then we'll ask Herwig, what would happen? You're Herwig, now you're working for Chris at the moment, okay? If Chris decides he would never do that, to hide the evidence, what would you do ethically and morally as head of the Public Health Institute working in Malta for Chris? So let's see the results, and then we got Chris and
tell you
Herwig
the
to comment.
results. Yes, it's not so clear than the first question. This time it's 2/3 say yes, decision makers should disclose everything. So they ask for full transparency. And 1/3, or it's growing, so it's more than 2/3 think yes, it should be revealed.
So my answer was yes, because
it was yes.
As difficult as it can be sometimes to disclose everything, transparency is the only way you can get trust. And in this situation, it wasn't just a question of making decisions at a government level, but it was a population effort that needed to happen. And those countries that did well were those countries which you alluded to earlier, where the people, as you say, behaved. And the only way to get that is if you have trust. And trust only happens if you are not found out to have been lying or hiding something.
Let's assume that Chris has decided not to share the evidence. So you economists, Herwig, love to work with assumptions and models. So what would you do, Herwig?
Yeah, but
what would you do if you were Antonio Fauci, for instance, or Deborah Birx in the United States?
Oh, that's a difficult question because I mean, basically, we all have some kind of ethical understanding and groundwork, so to say, and I think it's very difficult to give advice if the evidence base is not clear cut. So I would be totally in line with Chris, and what we observed in the Austrian context is whenever we published some information, actually the public debate on some kind of theories linked to not being transparent and some hidden agendas, all this debate dissolved. So basically this is really a good instrument, and I think actually one should do a review on actual policies, and I'm quite confident that the result might be that actually transparent information is most powerful in fighting this kind of theories of hidden agendas and so on. There's only one issue I think we have to address, and this is something that initially worried me. It does not worry me that much anymore, though. That is the issue of personal rights and the protection of personal individual histories. You know, if I think I went back to my initial village in the western part of Austria in the Tyrol, and it became clear cut that my kids infected my grandmother in the long-term care facility with COVID, for instance, and this could be something one could derive by individual data sets. You do not need to know necessarily the name or the age of the person. Then actually, I would be a bit afraid that people or group of people would become becomes stigmatized in a way. Even though I do not see currently for the Austrian situation, even the mass media and the rainbow press is very, very online or in line with the public debate. And then currently I do not observe this kind of stigmatization at the moment.
That's perfect. This is where the limits on disclosure actually do start because of the personal rights. Claudia, unless there are questions from our audience, you want to move us to the next question?
Yes, of course. Please, can we have the next question, please? Yeah. So which body should take the overall coordination in times of crisis? Is it the Commission, the heads of governments, the chancellors and presidents? Is it the Ministry of Health or the military, some said? Is it the regions because they are nearer to the patients? Or should it be a predefined team of experts as it should be defined in a generic preparedness plan each country should have? What's your opinion? Please vote now.
Perfect. In many countries, we've seen really prime minister offices, your office, Chris, taking over the whole thing, the whole communication, or in some other countries, the army. I like to move there to Norway to see how Norway is addressing that. I'm sure, Camilla, you'll be saying that the European Commission should be taking over, right? The decisions. I wonder actually how you put yourselves with this debate about the European Health Union and the European Commission being as you are in the middle, in the no man's land to some extent, between being in and out. If we have the results, Claudia?
Yes, we have very interesting results, I would say. Nobody opted for the military. But it's quite a team between the team of experts as defined in a generic preparedness plan, which is winning, it seems, and the Ministry of Health is next. So these are the two most favored options. Team of expert predefined. I think we didn't have that altogether, or the Ministry of Health and Social Affairs in the countries. Commission service, not so much.
Our online people are therefore disregarding the reality, which is in many countries.
Chancellors,
the chancellors, exactly, the prime ministers, President Trump et al., Boris Johnson are really taking the leadership. So it's very interesting. Camilla, I forewarned you. What is your view on that?
Well, I voted for the Prime Minister, President, Chancellor, etc. And that is because I think that is where responsibility lies. And you have to build on the system as it is. I wish that the European Commission and the EU were stronger and had a stronger position. And I will work for that. And I think there are roles that need to be developed, for example, for the EU and the European Commission. There are also roles at a regional level and at a local level in municipalities or counties or depending on how it's organized in different countries. But I do think that it must be a political responsibility at a high level across sectors to coordinate the response. So what you do see is that you have some leaders that are not good and people shouldn't have voted for them. And you see that there are leaders that are good, and it's good. And it's great that people did vote for them. But that's not about the function, it's about the actual representatives. By exposing that as a prime minister or president or whoever, chancellor, you do have such responsibilities in crisis, I think people will be much more aware that when they vote, they do vote for someone who's going to lead and coordinate under such circumstances. Now, having said that, there are, of course, roles for scientific experts that are not explicit enough. They are not secured by law sufficiently. The independence is not guaranteed. And I really think that we should work after this pandemic or even during this pandemic to secure independent public bodies. And we saw that in the wake of the financial crisis in 2008, 2009, that there was a strengthening of the bureaus of statistics, that their accountability had to depend on independence, high quality research capacity in order to provide independent advice on the actual economic situation in countries. Now, we do need similar or even stronger regulation of the independence of public health bodies, I think.
That's perfect. I would like, by the way, I'll quote you tomorrow, Camilla, on the plenary on the role of the European Health Union, if that's okay. Seriously. I would like someone to disagree with Camilla. Some would say, Camilla, that just for the sake of disagreement, really, that really policymakers do not differentiate politicians very well. What is the values, the leadership from the scientific evidence, as we saw with President Trump, and they mix it up. Perhaps they shouldn't be voting for them. I totally agree. Anyone would disagree with Camilla on that ground? Claudia, you can do that as well if you wish, because you are very much part of this debate.
No, it's fine. It's totally okay. I think we also have to look at time. It's almost 1 o'clock, so our session will stop soon, unfortunately. I think we just have warmed up into a good debate and we have questions there. But still, we could have one final poll and then come to an end. I think we have
Perfect.
to. So the poll is, who should, because I think it's really a communication problem sometimes, you know, we learned it also in Austria, not to only have the facts right, but to inform people in a good way. So who should be in charge of this communication in pandemic times? Should it really be politicians or the Minister of Health? Should it more be the virologists and epidemiologists, like in the beginning of the crisis? Should it be evidence generators and scientists themselves, so from the academia? Or should it be people like Herwig, perhaps knowledge broker advisors, or shall we leave it to media and PR professionals? So please tell us what's your opinion on this.
And while you vote, colleague,
Yeah.
that one links very much to the prior question, because the decision making and the communication sometimes go side by side, and the role of the communicators, many of them not well trained, as Herwig was arguing, they should be better trained, get into the area of quick on-the-spot decision-making and as they communicate. So that helps us as well to wrap up the prior question, still within the time, Claudia.
And
so what are the answers?
The answers are, I think, also clear. It should be the politicians or the ministers that should do the communication, and not so much the media or virologists and not the scientists. It should be them, because I think this is the debate also in the panel and in the questions we get from the delegates watching us. It should be those who take the decision have to communicate it well and clear and argue their cases. So this is a good message for people like Chris, I think, here.
But Chris, remember, is not the Minister of Health now. He is the Deputy Prime Minister.
But he could talk
Should it
to him,
be
huh?
the Prime Minister or the Minister of Health, Chris?
Today I'm acting Prime Minister, actually.
Okay. Sorry.
Actually, I voted for all of the above.
Okay.
Because I think there are different messages that need to come out. And there are different people who need to give different messages at different times. What needs to happen is that there needs to be coordination, and there needs to be a message which is not conflicting. So politicians, for instance, need to seek the proper advice before giving out information, and the experts need also to look at the other aspects of the message coming out, because sometimes it's not just about science, and I think you've made this, it's also about art, and I think communication is an excellent example.
We heard just from Gesundheit, we can go on a little bit more, so if it's fine for everyone, because there was one interesting question, I would say. It was asked from the delegates, are current government's actions to address the rise of the COVID infections, you know, by lockdowns or closing public places, really driven by science, or just by the political concern or even fear that we need to give the public the feeling that, you know, decision makers are in control on things? You know what I mean? Is this really the reason, the motor? Herwig, what would you say? Because I think you raised your hand.
I'm not quite sure whether this is the right question or not, and I'm not quite sure whether there is a misunderstanding that science can answer anything. In fact, as Chris put forward, it is political questions. It affects society, and if you ask actually who should be involved in this decision-making process, then actually I think if we have democracies that work and also governmental institutions that work, Rafa stressed a bit on this fact, that actually this helps a great deal to come through this crisis. And I will give you an example. We had a huge discussion I think throughout Europe, what to do with schools. And there is conflicting evidence. There is evidence that actually schools are transmitting the pandemic, and actually, for instance, our German neighbors were in favor of closing schools. And then there is other evidence that actually says there is no big transmission going on in schools and so on. Currently, you find both. And actually, the question is not whether there is evidence for one side or the other, but the question actually is, what are the impacts if you open up or if you close schools? And this is linked to society, this is linked to economy, and this is ultimately linked how we all deal in this crisis with the pandemic. And that's a political question.
On that, may I ask Camilla, you were saying, Chris, that they're all of the above, and somehow I agree. However, if there's no one single line, and we see all these scientists and virologists that they are gun-ho cowboys or cowgirls, taking their own communication, pushing their own ideas, and so on. No way, Camilla, how do you resolve that? How do you communicate there? Being transparent, being open, allowing all these actors to speak. Surely you want some sort of coherence between them, otherwise the population ends up not complying, as we said ad nauseum today in various occasions.
Well, I think it's important for the government and for the Prime Minister and the Minister of Health to be coherent and consistent and well coordinated, and also well coordinated with us as advisors. That doesn't mean that we necessarily always agree. So then we will communicate different messages. Because first and foremost, there is democracy and freedom of speech.
Good point.
Indeed. Claudia, I was wondering, as we're running out of time,
Yes.
whether we should do one final question, if you allow me, and then you will wrap us up with the conclusions. Is that okay, Claudia?
Perfect.
Perfect. So, colleagues, I'm going to ask you, all of you, you have 4 of you. It's a shame we lost Rafa Bengoa. A question that is partially philosophical, is a question that we want you to be transparent and sincere and genuine, as you have been today. We are very grateful, Claudia and I, which is, if now you go back in time and you are in March 2020, or even February or January 2020, what would you be saying to yourselves? You can talk to your former selves in your capacities. Trish, would you have been, for instance, been more for the precautionary principle at the very beginning? Anyway, Camilla, similar kinds of questions for you. So, what would be the talk, the personal talk? Reveal us what the talk would be with yourselves a few months ago, around 6 months, 7 months ago, this year. Shall I start with Trish? Trish.
Yes, I think I mean, I was arguing for the precautionary principle back in March, but I think the thing that I would do differently is pace myself differently. I used to be a long distance athlete, and I think I started this as a sprint. What I'm hearing from my colleagues in public health around the world, we're on an email forum, is we're all pretty exhausted, and actually we're just at the beginning. We're not towards the end. So although there's still so much to do, I think an awful lot of people have not got the energy. So I think we played it okay with building alliances with the media, with civil society, with policymakers. I think we got that right, but we worked unbelievably hard, and I think we should have just taken a little bit more of a break, because we're still in the middle of this. And someone told me it's going to go on for 17 years.
Please, don't give us this message at the end, please. Okay, I'd like to move now to Camilla, then followed by Hervik and Chris. Camilla, what would be the talk with yourself?
Well, all of what Trish just said, and in addition to that, create the science and never stop doing so. And that goes to those of us who are in that position, because we do need better science, and we need it rapidly, but the kind of science that's most needed, we still have very little of.
but we didn't have the evidence or the data to do that earlier on, so
Well,
it was really difficult.
We have to get that also. So we have to build an infrastructure for science that is much better than what we have so far.
Exactly. At least we should know, Camila, who's dying out of the epidemic. Don't you think so, the pandemic? We just still don't know at the moment in many countries. Some people are arguing that it's not 1 million, but probably 1.5 million or 2 million that died out of the pandemic. Hervik.
Yeah, it might be a philosophical approach to a philosophical question, but I guess I would stand back from any advice because I think initially what we are doing changes so often, and I am not able to make proper sense out of this story currently. What I would say now is actually that we are much in need actually of shifting our focus to 2021 and the next 16 years, so to say, to stay in this example of Trish. And what I currently feel, which is also due to this kind of long distance run and exhaustion in a way, actually we're prone or confronted with the second pandemic phase, and we have to think of 2021 and onwards. And this is our challenge, basically. I mean, and that's something we're in. But I doubt that if we had done things differently half a year ago, that we would not be in this current situation.
Thank you, Hervik. Chris?
I think what advice I would give myself would be to be Minister of Foreign Affairs rather than Minister of Health. But two points. One is to have better preparedness. So the way we've tackled this pandemic is sort of buying a fire engine or trying to procure a fire engine once we saw the fire. In other words, what we need to do now, and this is what we're doing, and I think most countries are doing this, is to have the fire engine on standby and hope you never use it. But if you need to use it, if there is a fire, then you can just wheel it out within minutes. And the second thing I would have liked to see better is better coordination between European countries. I am pleasantly, and I hope to be pleasantly surprised if we manage to have the vaccine procured jointly. I hope that will happen. It seems like it's going to happen. But I'm also, and I've said this on several occasions, disappointed that there was a bit of, especially at the beginning of the pandemic, a bit of exaggerated nationalism, where countries stopped exportation of what were deemed to be important resources, problems with closing borders. And I think if we have to learn a lesson, it will be to be better coordinated on a European level.
For the delegates following today, tomorrow's plenary will exactly deal with that, with the presidency, Chris, and those are the issues I'll be putting on the table. So if I have to summarize that, we needed to be better prepared for this marathon. Camila says she would like to see a little bit more of a spring there for the science elements, and perhaps, Chris, you're saying a bit more of a spring with the vaccine, but the rest is a marathon for which we needed to be prepared. So Trish, we all take you. You are a marathon runner, are very well prepared, actually, I know that. Claudia, let me now give you the final word to conclude us, thanking you very, very much for the excellent organization, the excellent thinking, intellectual background to this, together with your boss, Hervik, and to the Institute. Thank you very much for this session. So the conclusions are now yours.
Thank you so much, and thanks to everyone for watching us and for asking questions. We couldn't address all of them, but you know how this is with these sessions. I think, Chris, you said a very important thing. Then you said politicians want advice that fits within their narrative. This is exactly my experience with now 25 years in this topic, you know. Not for the pandemic situation only, but for always, can I say so. And Camilla, you said that you should ask for trust and think that Norway was not better than anybody else, but just lucky. Somebody could discuss that. Rafa said, you know, that it was really a problem with the insularity, so that the lockdown in Madrid could have been avoided with better communication and better working together. Yeah, this is a sad story. It's still not going as smoothly as it could be, I would say. And Hervik, you pointed out that it's a public health crisis now, and we're this health in all policy, I think we would all have loved it to have it more in a different setting, can we say so, to have really health in all policies like we have now. So for our lessons is, I'm relieved to hear from all of you, this is my lesson learned, my personal one, that it's understandable that we don't have perfect answers and perfect solutions. I think this is really helpful for all advisors and knowledge brokers in this session now to hear that also policymakers like Chris understand that there is no perfect answer. And Risha said, finally, we should go in parallel with things, continue to work to get evidence, do some studies. There's easier questions to be answered with RCTs and others. We still need to work on it. Hopefully not 17 years, as Josep said, but 1 year, I think it's still possible. So thank you all and have a good day and a nice Gastein Forum.
Thank you.
Thank you very much.
Back to the colleagues from the Gastein Forum.